Thank you for choosing the BNMS YouTube channel. My name is Simon Hughes. I work as a consultant in radiology and nuclear medicine in Birmingham in the United Kingdom. This is part of the applied CT anatomy course for PETCT and SPECTCT reporting. This presentation is part of the BNMS YouTube channel collection. The information provided in this presentation is the responsibility of the presenter and does not represent the views or opinions of the British Nuclear Medicine Society. Content is provided for education and training purposes and should not be interpreted as medical advice. If you have concerns about this presentation in any way, then please contact us directly and we will be happy to investigate further. In this discussion of CT brain anatomy, we shall concentrate on the axial unenhanced brain images. These are the images you'll see on PET-CT of the brain in dementia and epilepsy assessment. In this cartoon, we can see the major divisions of the brain on the lateral aspect. Posteriorly, we see the cerebellum. This is an important region for looking at routine grey matter uptake in multiple imaging modalities. And on the lateral aspect of the cerebrum, we see the frontal lobe, parietal lobe, occipital lobe, and temporal lobe. The frontal and parietal lobe are divided by the central sulcus, or sulcus of Rolando. The division of the parietal from the occipital lobe on the lateral aspect of the cerebrum is not clear. The superior extent of the temporal lobe is defined by the Sylvian fissure. The lateral aspect of the temporal lobe is divided into superior, middle, and inferior temporal lobe gyrus. It is not clear posteriorly where the division of the temporal lobe, parietal lobe, and occipital lobe are. We will see on the medial aspect of the brain that the division of the parietal and occipital lobe is much clearer. The surface of the human brain is undulating, and this increases the overall surface area of the grey matter. This is what gives the gyral pattern to the brain with intervening sulci. On this slide, we see a cartoon of the lateral aspect of the cerebrum with various sensory, motor, and association areas indicated. Again, note the central sulcus of Rolando and the Sylvian fissure. Anterior to the sulcus of Rolando is the precentral motor cortex, and posterior to the sulcus of Rolando is the postcentral sensory cortex, and together these indicate the sensory motor cortex. This is a cytoprotective area. That is an important sign in the association of intrinsic neurodegenerative dementias that we will see elsewhere in this lecture series. Again, note the three temporal lobe gyri divided by the two sulci, the superior, middle, and inferior temporal lobe gyrus, which we will again see is important in the assessment of dementia. Note Broca's area at the anterior aspect of the Sylvian fissure. This is the speech association cortex on the right side, and Wernicke's area, which is a comprehension association area on the left side, near the supramarginal gyrus at the posterior aspect of the Sylvian fissure. On the inner surface of the Sylvian fissure is the insula and the operculum, which are areas of grey matter not viewed on this lateral aspect of the brain. Next, we will discuss the medial surface of the brain, with again emphasis on important structures for PETCT brain reporting. The yellow gyral structure on the medial surface of the brain is the cingulate gyrus. The posterior part is important in the assessment of Alzheimer's disease, and the anterior part is important in the assessment of frontotemporal dementias, and we will discuss them in another talk. If you click as we discuss each structure, then different colored arrows will appear, and this will help you hopefully orientate yourself within this medial surface anatomy. So if you click now, you'll see the red arrow, and this shows the parieto-occipital sulcus. This is an area of intense uptake on FDG brain imaging, and can also be affected in Lewy body dementias, and is a true anatomical division between the parietal and the occipital lobes on the medial surface of the brain. If you double click, you'll see two pale orange arrows showing the deep white matter structure of the corpus callosum. These are the broad bands of white matter connecting the right and left cerebrum. In between, you can see the septum pellucidum, and this is a thin division that we'll see on axial imaging. And this is the little triangle of curving grey matter that we see deep to the corpus callosum. We can see the fornix, which is the yellow arrow, and this is a white matter tract that connects the hypothalamus to the mammillary bodies. The pale green arrow shows the interventricular foramen that connects the lateral ventricles to the third ventricle, and we'll discuss ventricular anatomy later. The two dark green arrows show the thalamus, an area of intense FDG uptake. And posterior to the thalamus, we can see the pineal body. Posterior to the pineal body, we can see the quadrigeminal plate, indicated by the two dark blue arrows. There are two superior colliculi and two posterior colliculi, so making four colliculi. These again are interiors of intense FDG uptake and are well seen on FDG PET, and we'll show you how these are used to define quality. There is one of the basal cisterns adjacent to the colliculi within the quadrigeminal plate. This is called the quadrigeminal plate cistern. With the first red circle, we show the pons, and with the second red oval, we show the medulla of the brain stem. Posterior to the pons, between the pons and the cerebellum, is the fourth ventricle. that's going to connect via the aqueduct, which is a very thin structure, through the midbrain to the region of the interventricular septum. And the fourth ventricle connects with the CSF around the spine and the brainstem through the foramen of Luschka, indicated by the dark blue arrow. On this slide we are seeing the first unenhanced CT scan taken high within the parietal lobe. Here I will encourage you, if you are performing PET-CT, to maximize the quality of your brain imaging. This will allow you to see this anatomy clearly. This is therefore a high MAS isovolumetric CT reconstruction. So in this high slice of an unenhanced brain, we start to see within the gyral and sulcal structure. The grey matter has a higher attenuation of about 80 to 90 Hansfield units. So this is the light grey band, which is seen on the surface of all the gyri identified. Deep within the gyri, we can see the lower attenuation white matter of 30 to 40 Hansfield units. This has a lower attenuation due to the high density of myelin with a high fat content. So the structure of the folded structure of the grey and white matter gives this gyral structure across the brain. And between these gyral structures, we see the lower attenuation CSF within the sulci. There are protective layers over the gyri between the grey matter and the sulci, but these can't be seen on the CT scanning. We will see later on that with high quality PET-CT that this sulcal grey matter gyral structure and white matter gyral structure can clearly be identified on high quality PET-CT modern imaging. On this slide of the unenhanced CT, we have descended further into the parieto-frontal region. You can see the gyral structure again. If you click once, you'll see multiple red arrows showing the multiple gyri within the left cerebrum. Again, I want you to identify or appreciate the details of the gyral structure that can be seen, the superficial grey matter, the deep white matter within individual gyri, and that these can be appreciated. And we'll see on FDG imaging, these can also be separately identified with high quality imaging. If you double click, you'll see two orange arrows. These are indicating the falx cerebri, and I'll show you later on the arrangement of the falx separating the two cerebellum, or the two cerebrum. We can see on the posterior aspect of the falx the dilatation due to the sagittal sinus. So this is containing venous sinus blood at 50 to 60 Hansfield units. That's why it's a slightly higher attenuation than the grey matter. On this scan, we've descended another few slices into the parietal and the frontal lobes. Again, we can see the gyral structure becoming more complex. We can see the gyri, the grey matter and white matter centrally within the gyri, and the intervening low cerebrospinal fluid, low attenuation cerebrospinal fluid within the sulci. If you click, we'll see the two red arrows, and this shows the central sulcus as a division between the right and left cerebrum. Now, this can be difficult to see in this like a young patient here, but this potential space widens to some extent with normal aging and with the development of atrophy. This contains the dural reflections of the falx cerebri that we'll discuss later. Note the little nodule of calcification adjacent to the falx. This is normal. If you click again, you will see 5 yellow arrows within the left hemisphere. And this is indicating the centrum semi-ovale. So this is a coalescence of the white matter tracts coming from the grey matter of the cerebrum. This coalescence of grey matter is going to form the centrum semi-ovale, continue to coalesce into the internal capsule, descending into the cerebral peduncles, and enter the spine as the long white matter tracts connecting the cerebrum to the spinal cord. On this slice, we have descended further into the frontal and parietal lobe. One of the things for me to point out here is that the dominant lobe seen here is the frontal lobe, and posteriorly is the parietal lobe, and dividing them, as we've seen before, is the central sulcus or the sulcus of Rolando. If you click, you'll see 2 arrows indicating the position of this. This can be difficult to define structurally, but remember this is the region with intrinsic neurodegenerative dementia, which is relatively protected, and therefore this is a region of maintenance of grey matter FDG uptake in the intrinsic neurodegenerative dementias of Alzheimer's disease, frontotemporal dementia, and Lewy body dementia. But again, it's relatively posterior in these axial images. Here we've descended further into the frontal, parietal, and the beginning of the occipital lobe within both the right and left cerebrum. Here we're at the level of the body of the corpus callosum. We will see this in more detail as we descend into the brain. So the corpus callosum is one of the basal ganglia. It has a head that we'll see is very important within anatomy, but it also has a body, and this is a thin structure that projects posteriorly superior to the lateral ventricles. This is an important structure for us to recognize on PET-CT because it is at this level that we will define the intensity of display of the FDG PET-CT, and we'll come back to that in other lectures. It is difficult to appreciate on the CT scan. It can be seen on MRI imaging, but we will see that it is identifiable in all of the FDG components of PET-CT brain imaging. So this is why I bring it to your attention right now. Also at this level of the body of the corpus callosum, the very superior aspect of the body of the lateral ventricles, we also see the right and left posterior cingulate gyrus. Again, these are very difficult to see on the CT, but are easily identifiable and appreciated on FDG imaging. We will see again that we will be able to identify on FDG both the right and the left posterior cingulate gyrus as two separate parallel structures in high quality imaging, and we will see their divergence as this descends towards the hypothalamus. This will all come up in later imaging, and we will repeat these important appreciation of these important structures over and over again. Thank you for watching part 1 of the brain anatomy, part of the applied anatomy course for PET-CT and SPECTCT reporting. And there's 4 other parts. If you want to see them in the BNMS YouTube channel, and I look forward to talking to you there.